Thank you. So I'm really happy to be here, although I'm in online mode. It was not supposed to be a hybrid workshop. So, I hope all of you are having a good time at Porto, Spain, attending this workshop. And thank you to the organizers, IS Education Fund and PANCAP for inviting Unitaid and to PAHO and colleagues at Global Fund for being part of the organizers. So today I'm quickly going to talk about Unitaid's approach to reduce preventive HIV mortality. So you all may have heard of Unitaid. Unitaid is a small donor in the global health landscape. We are a pathfinder, an investor, an influencer, and we work with a large number of partners. We save lives by making new medical products available and affordable for people in low and middle income countries. We work with partners to identify innovative treatments, tests, and tools, and help address market barriers which are holding them back and help them to reach those products to the populations fast. So some of our implementers are in this on this slide. As you can see, there are more than 40 to 50 of them. We are funded by mostly by governments. So our Unitaid has a board which directs us. So most of our funds are public funds, but we also do obtain some kind of foundation funds from agencies like the Bill and Melinda Gates Foundation. So as of the end of 2023, Unitaid's portfolio totaled $1.6 billion and we US dollars. And we work in the areas of HIV and co-infections, tuberculosis, malaria, women and children's health, global health emergencies, and cross-cutting areas. So as you can see, our investments in HIV constitutes 25% of our portfolio. So how do we work? We identify health challenges, we find potential solutions for them, working with partners, and then we invest in the innovative products, for which we do a lot of work on testing their effectiveness and developing evidence. We then work with our partners like WHO to use the evidence for policy change, and then we scale up those products for use in countries and for better reach and access to the populations in need. So Unitaid's work is underpinned by the Unitaid strategy. We have a 4-year strategy cycle. The current strategy cycle runs from 2023 to 2027, and it's available on the Unitaid website. So our focus is on health products, access to those products, and people. So we have 3 strategic objectives: strategic objective 1, 2, and 3, which addresses 3 of these pillars. Unitaid's operating model, this is how we operate based at Geneva. So we are an organization based at Geneva. We are part of the WHO. We are hosted a partnership of WHO, and we identify opportunities for interventions working with partners. So most of our ideas come from partners in the global landscape, like the WHO mostly, Global Fund, and various other partners. And then there is a selection process based on the value that product would bring. And based on that, we develop areas for intervention. AFI means area for intervention. There would be calls for proposals, and partners are invited to apply. And once the proposals are developed, then there is a selection process again, and there would be go ahead, because not all applications would be taken up. Those which are selected will then go into a phase of grant agreement development, where we will look at how we can implement that and translate the use of those products onto the programmatic scenario in countries. And once the grant agreement development is completed, which is complete when we have the project plan, the logic framework and the budget's ready, then it goes for approval and then it gets implemented in countries. So Unitaid, besides the working model, we also have something which we call the programmatic priorities. So in each of our areas of work, HIV, TB, malaria, women and children's health, and pandemic preparedness, we have priorities. And then in the last 3 to 4 rows, you can see the cross-cutting areas, which then straddle all the programmatic priorities and work areas. So now to talk about what we do in HIV, of course, you're all familiar with this picture, which is from the UNAIDS fact sheet. This is a summary of the global HIV epidemic, and the number of people living with HIV is estimated to be 39.9 million as on 2023, and there are 1.3 million HIV infections. I also have the next slide, which talks about the progress to the 95 targets and the treatment cascade. So this is by WHO region, and I just encircled PAHO here because we are today talking mostly of PAHO. And as you can see, the treatment cascade here, the achievement for PAHO are 89%, 72%, 66%. This is Unitaid's HIV portfolio, a snapshot over time. The organization was founded in 2006 after the founding of the Global Fund. And in the early days, our investments were into pediatric ARV formulations and adult ARV formulations. But later, we started working on HIV diagnostics. So we had the viral load EID and CD4 followed by POC diagnostics. Then we also started working on HIV prevention and HIV self-testing during 2016 to 17. Now we also recently started working on cervical cancer and advanced HIV disease. And all the work on HIV is strengthened by some cross-cutting work, which are in the form of the WHO enabler. And there is the medicines patent pool, which has helped enable licenses of various HIV drugs in generic form to many countries, and this has helped in price reduction significantly. There is also the WHO pre-qualification program, which has helped improve availability by engaging manufacturers and assuring quality of drugs. So in a nutshell, this is Unitaid's HIV and co-infections programs. So cumulatively, 394 million has been invested in the HIV portfolio. This also includes some of the cervical cancer and hepatitis C grants. And we have had 15 projects and 13 countries have benefited with direct implementation. Of course, it's not only these countries. Later, those products are made available globally, so other countries also tend to benefit afterwards. So Unitaid's HIV prevention portfolio, we have products which address PrEP, peri and postnatal prevention, harm reduction, and enabling elements. So the dark blue boxes below, they have some of the active grants and the recently closed grants. So you can read them here. Since it's a short presentation, I'm not going to details. So the PrEP, this is an overview of a PrEP. So we recently had a programmatic priorities report, and we have sort of looked at what were our results when we started and how it's proceeding. So under PrEP, our focus products were oral PrEP, long-acting CAB, dapivirine, vaginal ring, and other PrEP products. And we have identified focal populations. The cumulative amount of project expenditure was 49 million in the PrEP grants. This is a diagnostic portfolio where we have HIV testings, co-infections and co-conditions testing, and enabling elements. So for the HIV testing, we did a lot of work on self-testing and in the RDT manufacturing, and we have the previously the previous grants which have closed now, such as the Atlas Holtis grant, the MTP grant, UPSC viral load grant, etc. And we have currently these active grants in the 3 areas, as you can see here. So this again is a summary of what were our results on the HIV testing and diagnostics portfolios, and the products we had were oral fluid HIV self-testing, blood-based HIV self-testing, HCV self-tests, and self-care tools which link to prevention. The cumulative expenditure on the testing portfolio was around $69 million US. And here we have clubbed both the HIV treatment and AHT portfolio together. So we have had projects on antiretroviral therapy, AHD, and the enabling elements. So in this, the portfolio for ART, which we had started since the inception of the organization, so that runs to around $92 million US, and for the AHD grants, it stands at a $25.7 million expenditure. So this is a summary of the products and the expected results for both the ART optimization and the AHD packages of care. So I'll just have a few slides focusing on what we've done on the advanced HIV disease. So in phase 1, which ran from 2017 to 2019 to 2023, we worked on the focal products, which are in the small box in the corner. So we had the drugs, flucytosine, liposomal amphotericin B, fluconazole, and TB preventive treatment. For diagnostics, we had the CD4 RDT, device-based CD4, TB LAM, cryptococcal antigen LFA. So we were able to achieve a price reduction of some of the products. We provided catalytic procurement and product introduction support in countries, helped in market coordination by engaging with manufacturers, decentralization of screening, including trying for same-day AHD screening, supply security for optimal AHD treatment, including some catalytic procurement, demand generation activities amongst health workers and PLHIV, transition of the AHD programs. So in the phase 2, which starts from this year, it already started last year, and now we've moved into this year. These are our objectives. We're looking for the introduction of emerging tools that could implement the current care package. And we're also looking for innovative approaches to enable increased utilization of the Stop AIDS toolkit to prevent, diagnose, and treat AHD-associated opportunistic infections. So the current portfolio has these 3 grants. There is a grant by the Aurum Institute of South Africa, and they have a big consortium consisting of DNDi, MA, PATA, and Saltis, and they have 6 countries. It's for 3.5 years. The CHI grant, so I think the Aurum grant is for $17 million. The CHI grant is with Africab and Penta, and it's referred to as Thrive, and it addresses 6 countries. So there's all these countries are in Africa, and there are, I think, in 2 countries are overlapping in 2 of the grants. We have the PAHO AHD Enabler grant, which is addressing which has got more focus on 10 countries, but it is available for all PAHO countries. And this project is for 2.5 years till end of December 2026. So these are the expected outputs. So there are these 5 outputs which Omar already mentioned. So we are looking for evidence generation, supply side interventions, country readiness and transition, community engagement, and global advocacy and partner coordination. There are some expected deliverables against each of them, and expected targets for country reach and evidence generation activities and supply side interventions. Alongside, we are also working with WHO because WHO is our most important partner, and all the actions we are doing are to enable the Global Fund and WHO to help translate the new products into programmatic settings. So, as you can see, our since 2017 to date, we have had multiple rounds of, I would say two rounds of WHO enabler grants, and we make sure that our programmatic priorities are in line with the WHO strategies in HIV, viral hepatitis, TB, malaria, cervical cancer, and STIs. So this simply maps out the Unitaid's programmatic priorities against WHO's work stream. And of course, it also exists in TB and malaria. So before I conclude, I just want to mention the Advanced HIV Disease Alliance, which was earlier being chaired by WHO and was referred to as the AHD Implementation Strategy Committee. So now this has been broadened to be made into a partnership body, and we've identified spheres of work, actions, and potential outputs and indicators for success. So going forth, this AHD Alliance will be working to identify new partners, new donors, and help improve the country representation and attention to pediatric and market access through dedicated discussions. So that's my last slide. With that, I would like to end, and I'm happy to take questions later at the end if you have any. Thank you very much.